The member for Braddon has the call. The member for it's the independence question. The member for Indi has the call.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister for Health. Minister for Health, currently representatives from three Victorian multi-purpose health services are visiting the parliament, discussing the viability of services, negative implications of changing funding arrangements and the need for review of funding arrangements. Minister, can you please commit to the House that a review of funding will take place in order to ensure that we have long-term sustainability, efficient, effective and targeted delivery of health services to our regional communities?
Member for Health.
Thank you very much, Mr. Speaker, and I thank the member for Indi for her question, which I understand focuses on the delivery of health through multi-purpose services in her electorate of Indi, and I know she has several in Corryong, in Bright, in Mount Beauty and parts of the Alpine Shire. And I can reassure the member for Indi that the review of which she speaks is well and truly underway. Members of the House, particularly rural and regional members, may know that the MPS model, very good, very tried and true, but hasn't been reinvented since 1993, does need review. And what it does is provide a combination of both acute and subacute services with aged care residential services in small regional towns. And it's a model that has stood the test of time, but it's appropriate, given our changes to aged care funding, that we review this, and the Independent Aged Care Financing Authority is doing exactly that. Mr. Speaker, as rural and regional members of the House will understand, aged care doesn't look the same in every part of Australia, and it's vital that where we look after our most important frail and elderly in rural and regional Australia, that we don't do it in exactly the same way as we might do it in the big cities, that we understand that for people who've grown up and spent their whole lives in small country towns, a move of even 20 or 30 kilometres down the road can be a move too far. So I'm very committed in making sure, as we, of course, keep older Australians healthier and happier in their homes for longer, remembering that only 5% actually do go into residential aged care, as we do that, we provide models that work well for individuals, that empower individuals with the choice to determine their own destiny.
Blair.
Totally appropriate, whether you happen to be 23 or 93, and that we recognise that the supports and the policy that the federal government puts in place needs to capture the wants and needs of our older Australians. So I look forward to the independent authority that I spoke about doing the review and picking up on the interests of not just the member for Indi, but all members in this place.